Good evening, everyone. I'm Richard Piacentini. I'm the president and CEO of Phipps Conservatory and Botanical Gardens. And on behalf of the board and the staff and all our volunteers at Phipps, I'd like to welcome you and thank you for joining us at our first, what we expect to be an annual Nature of Place Symposium. We're really excited to see all of you here. I'm really excited to see lots of new faces and some familiar faces, but I remember looking over the invitation list or the attendance list, and I see a lot of names that I don't recognize. So it's really great to see some new people here and to see.
You didn't say old faces.
And old faces too. Thank you, Volker. It's great to see all of you here and to see, so many people from so many different backgrounds here, which is really important because, after all, nature connects us all. So that's really important. When we first put this conference together, we were going to call it a biophilia symposium, but we were afraid that some people still might not know what biophilia means. For those of you who don't, biophilia refers to the innate love of nature or love of life that we all have. It's in our DNA. It's a term that was coined by Erich Fromm in the 1960s and made popular by E.O. Wilson, a really prominent biologist. And someday we'll switch the name, but for now we're just going to call it the Nature of Place because really we really want to talk about nature and how important it is to us. And nature really is important to us. It's important to us for our health. Being connected to nature really makes us healthier. It also helps us build compassion and caring for the environment and for each other. Over the course of between tonight and tomorrow, you'll be learning about biophilic cities. You'll be learning about a sense of place, health and wellness, spirituality and equality, and access to nature. Tonight, we're really excited to have Dr. Michelle Kondo as our keynote speaker, and she will be speaking about nature-based strategies for diseases, injury, and violence prevention. Dr. Kondo is a research social scientist with the USDA Forest Service. She holds academic degrees in civil engineering and urban planning, and obtained postdoctoral training in environmental health and epidemiology at the University of Pennsylvania. Her research examines environmental strategies, including place-based, nature-based, and clinical interventions for disease, violence, and injury prevention with a focus on low-resource urban communities. And I might add, she's also a CMU graduate. And I'm happy to say she recalls coming to Phipps many times while she was at CMU. She also admits that it's changed quite a bit since then. I was pleased to hear that. And I'm glad that she gets to see the new Phipps and to be able to explore it while she's here. We're really excited to have you here, Dr. Kondo. We're really looking forward to your presentation. So please join me and everyone in welcoming Dr. Michelle Kondo.
Thanks so much for having me. It's an honor to be here. How's the sound? Is it good? Good. Yeah, so I'm here representing the USDA Forest Service. And it's my suspicion, just based on the audiences that I have interacted with, that a lot of people in this country are not aware that, number one, there is a Forest Service. Well, what is the Forest Service? And number two, what does it do? And three, that it is active in cities and urban areas. So it is true that our primary mission, is to manage our national forests. There are about 190 million acres of national forests, and most of them, by land area, are in the West. But it's important to note that the national forests, all up and down the eastern seaboard, are in closest proximity to people, to humans, and so we have this maybe a stronger sort of human forest interface there. So I think that it's fitting that this concept of the urban field station was born out of my region, the Northern Research Station. I am stationed in Philadelphia, and there are a handful of us scattered throughout the country. And we being, the scientists in these stations, we focus our study on the role that trees and forests in cities play in, as vital resources in these coupled or combined social ecological systems. So I really do, I do want to give some credit to the Forest Service for stretching and growing beyond the more traditional, forestry sciences or, ecology, stretching its science to more broadly encompass land and natural resource management questions facing urban populations. So actually my own story is tied to this institutional shift. I have to tell you a little story. After I started working for the Forest Service, it had been a couple of years. I was sitting at the dinner table with my mother, and she just said, sort of out of the blue, "Isn't it funny? You're a Forest Service scientist, USDA Forest Service. My grandfather, or your great-great-grandfather, was a forest ranger in the Olympic National Forest." Oh. And my mother, your grandmother, was a secretary for the USDA. What? So I didn't know that I had any connection to the Forest Service, and it was a surprise to me, and likely is a surprise. I think that I'm a bit of an outlier in the Forest Service, and that I'm doing research in sort of bridging and translating and the environmental sciences with health sciences. But I do want to say that, I think the agency has shifted, perhaps with society, a little bit over time, and is more flexible in the roles that different individuals are playing. And there's much work to be done there. But anyway, so shifting to my research, I have done, there is an expanding body of research here on this relationship between nature in general and human health. I think it's about on a daily basis that I get, if you're like me and you get these Google alerts about citations, so new studies published, it's on a daily basis that we're seeing new evidence here. And I could talk the rest of the hour or the rest of the week about this evidence, but I want to sum it up for you just a little bit here. We see, and I've done my own synthesis here, and the Northern Research Station as well has done its own synthesis, really focusing on the urban context. We see strong evidence for negative association between nature exposure, and I want to talk about what does this mean. I will talk about it later. But nature exposure and premature mortality, so negative association with heart rate. So in the short term, we have, of course, I think we know this. We have this gut instinct. We're calmer when we are in greener environments. And this can be an indicator of stress. That there's negative association with crime and violence, now we are seeing, as well as shorter post-operative recovery times. And then when we are in natural environments, we are better able to focus and pay attention, where our mood is better, mental health improves, so less anxiety and stress. And now we are seeing evidence of improved birth outcomes, so higher birth weights. A lot of this new research that's coming out fairly recently in the past few years, very exciting because it's based on big data. We have got our hands now on big data. So we're talking about electronic medical records, sometimes from entire countries, entire continents. So we're talking millions of people, and we know where they live. So we also know then about the quality of their, or quality characteristics, let's say, of their environments. But I do want to say, give a caveat to this research, and I'm a little bit skeptical or I'm motivated, as many others are, and some in this audience, to help move this research area forward. We are often now combining electronic medical records with very broad or coarse data about the characteristics of our environment. So we typically are characterizing green space or the greenness of residential environments using this. This is an image of NDVI data, which I'm not going to spell it out, but it's basically a measure of the green reflectance off the surface of the Earth using satellite imagery. Usually it's at this 250 meter resolution, and each grid cell has a value between -1 and 1. I've made it green artificially so that you might see something, maybe some trees or something represented here. But to me, it's too coarse. It doesn't give us really a good idea about the quality and quantity of natural features in our environment. And it doesn't speak to me, and I don't believe that it speaks to residents of Pittsburgh or of Philadelphia. And so how can we move this research forward? I think that I take my responsibility as a federal scientist very seriously. My research has to be applied. It has to be applicable to the the everyday lives of the people that we represent. And that everyday reality very commonly in this region is characterized by vacancy. And so over the past 5, 6, 7 decades, we have had this historic population decline due to a number of things, and among them federal policy, housing, transportation, redlining, historic redlining. But we have seen basically a systematic disinvestment in urban areas, resulting in oversupply of vacant property. And it's a sort of lived reality that so many, perhaps a majority of residents in cities like this are dealing with. I can say that in Philadelphia, there are, by some counts, between 32 and 40,000 vacant parcels. And we know from talking with residents that are living in and amongst sort of high concentrations of these places that they attract what is called short dumping. It even has a nickname in Philadelphia. So this is where contractors are dumping their construction debris. They attract rodents and pathogens, illicit activity, and they just incite fear and anxiety for the people that must interact with these spaces. It's a major problem, and it affects the health of residents. So I like to draw from this model from Ana Diaz-Rue, because it includes this element of segregation by race and class and resource inequalities, which leads to neighborhood physical environment inequalities and neighborhood physical and social environments, which then can lead to stress and other sort of health behaviors and ultimately health outcomes and health inequalities. We have evidence from some focus groups that we have run. And this is associated with a project in New Orleans. And it is directed by Catherine Thiel, that neighborhood blight in combination with violence sort of exacerbates underlying health conditions that people are dealing with. Yeah, so blight, violence, and substance abuse really are the key issues for residents that came out of this set of focus groups. So what is the solution, and does nature play some role there? I think in the traditional medical model, we tend to take the individuals that are at the highest risk right? And we provide counseling and education. So we pull them aside and try to teach them, you really should start eating better. You should stop smoking. But we know while those types of interventions are important, and I'm not saying that we should stop them, but they are very expensive and often they don't work. So I think that a public health approach now that is emerging is more focused on changing in everyday environments or contexts in which individuals are making decisions. I mean, as we know that it's really difficult to change our ways, our habits, unless the environments around us change. So are there environmental solutions that can help change decisions, behaviors, and ultimately health of residents? And I asked this with my research. So I'm going to talk with you about some research that I have done on some place-based or nature-based interventions, looking for impacts on public health and safety. So a couple of types of interventions: one, green stormwater infrastructure projects, and vacant lot greening. So first of all, as I said, I really like to focus my research on interventions or real changes to places. And perhaps this is because of my background and training in civil engineering, so I really love to think about infrastructure, as well as in urban planning and urban design. Some of these urban design studios that I took here at CMU, I've taken them away, the lessons away with me. But I see projects and programs such as green stormwater infrastructure in Philadelphia as an opportunity to think about, what types of social and health-related impacts might we be seeing? What are some of the co-benefits of these types of projects? And the water department in Philadelphia shared this question. And so we partnered up and looked back in time at the 52 projects that they had installed between year 2000 and 2012. And I brought some photos along with me to give you an example of the types of things they were installing. But I think that you see them as well around Pittsburgh. So stormwater basins, curb bump outs, tree trenches, wetlands even. And most of these projects had been installed in and around the street, so in the transportation, the right-of-way. We matched these sites with control sites, we call waitlist control sites. So these were sites that perhaps they were in feasibility stage, so nothing had been constructed there yet, but they were candidates. And we looked at changes in crime rates. We had the exact location of every crime, at least that was reported, throughout the study period, starting from before the first project was constructed to after the last project was constructed, at least during our study time. We also included some health data, a little bit coarse, so it was at the census tract level. Some indicators of high stress, high cholesterol, and high blood pressure. And we looked for change. So we looked for change, between the treatment and control sites, before and after the interventions. And this is just a map showing sort of a density map about where our treatment and our control projects were located. We controlled for sociodemographic change throughout the time period, so we weren't seeing change in crime due to changing demographics. And we found significant reductions, statistically significant reductions, up to 27%, at these GSI sites, green infrastructure sites, in narcotics possession in particular. And so this is, I think, drug buyers, right? So interesting that it is in the public right away. We didn't see any differences in other types of crime, violent crime, or property crimes, actually. Also, no change in levels of stress, instance of high blood pressure or cholesterol. I want to share with you also sort of a growing body of research now that we have been conducting with vacant lots or vacant land remediation programs. And the first that I will tell you about is it's another observational study. So we're looking back in time. The ideal is to run an experiment where you're randomizing everything. So it's sort of like you might run on a drug, right? A drug study. But some of these earlier studies were based, observationally. That we're looking back in time, and we didn't have that random process. But the city of Youngstown approached us and said, we have this program, Lots of Green. We have been taking vacant lots and cleaning them up. We have two versions. So one is this, what we call a contractor, clean and green, professional, mowing comes in. So they will clear the lot, plant some grass, put up a picket fence and plant a few trees, and then routine maintenance. They also had a second version, which we are calling community reuse, where residents could apply for support to do what they wanted with a vacant lot in their neighborhood. And most of these lots, I think there were about 80 of them, were community gardens or orchards. And so they wanted to know, the city said, we feel like we're having an impact on crime rates in these neighborhoods and around these lots, but we want your help evaluating whether or not this is true. So we did. We ran sort of a similar analysis. We matched these lots up with control location, vacant lots that were left vacant throughout the study period. And so you can see in yellow and blue are we're calling treatment lots, and the gray are the control lots. They were quite clumped, our treated lots in two different neighborhoods, so we had to use some fancy statistical models to sort of parse out these effects. But we found evidence, and this was interesting, around the contractor sort of clean and green lots, reductions mostly in property crimes. So these were significant reductions, mostly in property crimes. As opposed to around the community reuse lots, we found mostly significant reductions in violent crimes, which made us think, is there some role that engagement and ownership in this process might play in sort of the social dynamics that are occurring around these places? So we also tested for displacement. So we had a lot of folks help us, develop this question. Well, is crime just being pushed away from these places? And so we tested for this, and actually we did not find any evidence of displacement. In fact, we found evidence of benefit in surrounding areas. I should note that we found statistically significant increase around all lots in motor vehicle thefts, all of these treatment lots, which, is interesting as well. Motor vehicle theft, so here we have a timeline of sort of observational studies, as I said, not including this element of randomization unless it's in that matching process with the controls. But they all helped us convince NIH and CDC to fund a larger project, an experiment, or a randomized controlled trial, which was, we finished up in 2018, and this was under direction of Charlie Branis at Columbia and John McDonald at University of Pennsylvania. A randomized controlled trial. We took 600 vacant lots in the city of Philadelphia, And we randomized. We randomly assigned them to be either, to get a treatment and or to be a control. So we had a 38-month study period. And again, we looked at, pre-post treatment control differences. I brought some pictures here of the type of treatment that I'm talking about. And these were done by the Pennsylvania Horticultural Society, which I know is also active here in Pittsburgh. And so this is a standard treatment. This, you can't see it, but these fences are permeable so that pedestrians can enter. But there is an issue with, because the city owns about 25% of vacant lots in the city, and I think it's similar in Pittsburgh. But so on privately owned land, the city will post notice of a violation of the building code and give a certain amount of time to come into compliance. And if not, then the city will, via the Horticultural Society or PHS, will come in and do it, the remediation themselves, and place a lien on the property. So that's mechanistically sort of how it works administratively. But the city can't really invite use onto these spaces. So here's some more pictures before and after. And here's a map of the location of our lots that were very much randomly, sort of spatially located throughout the city. We made sure that they were balanced in terms of socio-demographic, characteristics of surrounding neighborhoods, so that we didn't need to control for those things. And we found at the treatment lots significant reductions in crime overall, but specifically in gun violence, burglary, and nuisance crimes, but especially in neighborhoods below the poverty line. And I should say, also I want to mention that we did some surveys. We surveyed people that lived near these lots, all the control lots as well, about 450 people. And we asked them about their perception of crime. So we also found reduced perceptions of crime, vandalism, and a significant increase, reporting of use of outdoor spaces for relaxing and socializing, which could speak to some of the mechanisms for these findings in the crime incidents. One thing that I really like about this study is that we partnered with anthropologists. We had some ethnographers sort of set up a chair in 2 micro neighborhoods, or small spaces, where before, during, and after they could observe what is going on with these vacant spaces, and how does it relate to this intervention. And they set up camp in 2 neighborhoods that on paper looked equivalent, but one felt under threat of gentrification, whereas the other did not. No sign of development. And they found actually different reactions to the greening effort. So in the neighborhood that felt under threat of gentrification, there was hostility toward it. Neighbors, really, they weren't convinced, and they thought, well, this isn't for us, and it's just going to displace us even further. Whereas in the neighborhood that felt no threat of development, they were very positive about it, and we're hopeful that there might be more of this type of program. So, but we also wondered, what is happening? Why are we seeing this reduction in gun violence? Is it because that people are stashing guns in these lots that are overgrown? And what we found were that, well, number one, these vacant lots played a role in the drug trade. That these are storefronts often, the vacant lots that are left untended. And that weapons are often stashed in cars that are parked in front of the vacant lots, so not stashed in the lots themselves. So this intervention sort of disrupted these processes. And so speaking to other mechanisms. In a separate study or analysis of the survey data, we found, or just really focusing on mental health, we found significant decreases in reporting of depression, feelings of depression and feelings of worthlessness as well for people that live near the intervention lots compared to those that live near controls. So how do we think this works? There are a number of theories out there that we think are relevant. And so, for example, the busy streets theory, which is actually fairly new. It's come out of University of Michigan and Mark Zimmerman, as well as Wilson and Kelling's broken windows theory, out of criminology, routine activities, situational crime prevention, or CPTED. But in general, I think that the idea is that this type of intervention can disrupt this iterative cycle of physical disorder, which causes people to be fearful and to withdraw from public spaces, which can lead to weak social control, less sort of positive connections between neighbors, which can lead to more serious crime, and this sort of cycle goes on. Can greening help to intervene and disrupt this cycle? So as Wilson and Kelling, I think their broken windows theory is very fitting, and I try to dissociate this theory with the broken windows theory of policing. I don't think that the policing theories here really apply. So, but just as broken windows left untended in a building is a sign that no one cares, leading typically to more broken windows. So disorderly conditions left untended in a community are signs that nobody cares and lead to fear of crime and more serious crime and urban decay. So we're beginning to test these theories. So with this research. And so number one is, what is it busy streets? So where youth can grow up in a safe and healthy context, where they observe positive behaviors such as neighborliness, experience trust among neighbors, and develop a sense of community where neighbors work together to achieve common goals. Is community engagement in neighborhood improvements, such as this vacant lot, remediation, is it a vital ingredient toward building busy streets? And I'm proud to be a collaborator in the Michigan Youth Violence Prevention Center, where we are running research in this area in three sort of more mid-sized cities. So Flint, Youngstown, and Camden. We have three groups of parcels. One of them is community and youth engaged parcel improvement and mowing. We also have this professional mowing arm and a control group. And then we are collecting around these lots every kind of social data that I can imagine, at least. So we've got parcel assessments, systematic social observations, surveys of residents about neighborhood life, about individual, family, community health. We've got crime incidents, and as well as injury data from local hospitals. And so analyses are underway. We have a preliminary study of just data from Flint, where we found 40% reduction in assaults and violent crimes around the community engaged and youth engaged interventions, greening efforts. So we have now a body of evidence of, on this type of urban nature, nature intervention, and the types of sort of social and health benefits and changes that we might expect from them. It's time to pause, I think, and talk about, are there any unintended consequences that we're not measuring that we may be seeing? So what about gentrification? The Brookings Institution just recently, released a report, and Jennifer Vey says that innovative economic growth in cities will inevitably have a destructive impact on poor residents. Is it true? Is it happening here with this type of remediation? So this is a question that we have, and if it is, what can be done about that? So we think that, connecting local residents to nearby employers, so thinking about employment and jobs is critical, growing local businesses, and all of the interventions that you saw here. PHS, for example, they contract with minority women-owned businesses only, I think, as a policy to do this landscaping work. Improving neighborhood schools, so talk about important infrastructure. So just like roads and, we have to think about other infrastructure that is vital toward these communities, and working with residents to create quality places in which of which all people feel a sense of pride and attachment is vital. And we're beginning to think as well about, I think more cities are approaching us and asking, can you help us evaluate our programs as well? How should we do it? Can we do it in a way that will affect this or that type of public health issue that we're dealing with? And there are a number of challenges that we should stop and think about. Number one, where do we get the resources to do such work? I think we've shown, at least in Philadelphia, that it's a financial gain for the city to invest in this program. Since this research has been going, I think just last year the city increased its budget from $3 million to $5 million to fund this type of work. And in part due to our findings, I think, have supported that political will. So political will is very important here. How do we plan for sustained programs? So maintenance is a huge element of these successful programs. And then how to engage and in communities, in and with communities, to conduct and create, culturally and socio and economically relevant programs that community members can take ownership of themselves. And then how does context matter in this type of program? Is it a one-size-fits-all, or do we need tailored interventions to different settings and situations, scenarios? So a lot of questions here, more questions to answer, and always looking for partnerships and collaborators in this type of work. Thank you very much, and I hope that we have some discussion.
So we have time for a few questions. If you notice, on either side of the room, we have a few different FIPS staff that have microphones. So if you have a question, just raise your hand. They will come find you, and we'll get to hear a little bit more about some of your work.
Okay. Hi. I wanted to ask about something that I think you know something about, trees. And because I'm wondering where, I think it's fair to ask a person from the Forestry Service, but really in terms of the work, whether it's your research or other people's research, what kind of attitudes and or impacts have you seen in terms of cities that have not just a sort of a vacant lots and greening and the kind of strategies, a lot of variety, they're very interesting, but also what kind of, whether specifically increasing tree cover or whether there were positive or negative responses from communities or positive or negative impacts on the kind of subjects you were looking at?
Yeah, that is a tough issue. And I know that, so in Philadelphia, we just had released our updated urban tree canopy assessment. So representing 2018, we are previously, we had 2008 was our most recent. So now we have this ability to detect change. And the answer was decline in urban tree canopy. Yes, which is devastating for all of the people, the neighborhood groups, all the steward groups, and all of the city departments and nonprofits that work so hard to increase the tree canopy. And so what's the answer? And so much of it has to do with this public acceptability and or will or motivation, interest in having a tree. And there is a lot of hesitation in Philadelphia, and I imagine in other cities and contexts, having to do with liability and sort of mess and asthma, pollen or allergies, and what else? There are so many things, and so I can't speak very much more than that. But I think that there is a lot of room for opportunity to work with behavioral economists. Yeah, so pairing up forestry and some folks that can work on sort of marketing and figuring out how to make a cultural shift in sort of these views about trees. And it's also a very challenging physical setting. So many of the streets in Philadelphia, the sidewalk is this wide and the front stoop is this wide, and there's just not a lot of space for anything other than cars. And right, yeah. So people prefer to have their cars, yeah, I'm not sure. Sure.
It's funny to have a mic. I was just curious. It seems like such a, from a science perspective, such a difficult problem to assess because there's so many different variables and, the different approaches. You were talking about observational and randomized. So what are, without getting into, I know it would be a really, really long discussion to talk more in detail about the scientific methodology behind it. Just like what are kind of some of the trials and tribulations or ups and downs that you've found over the years that you've gotten successes or have been able to really narrow down and create more causation? Because I was just really impressed with all the different factors that you're kind of correlating together.
Oh, thanks. Well, I would say that that this randomized experiment that we were able to run is really the ideal and what we would like to achieve. But to get the kind of funding to do that type of study, it takes millions, right? Both, the funding from the grantors often, well, not often, it needs to go toward the intervention. So it has to go to the Horticultural Society to do the remediation and also to fund the study and collection of the data. But to convince the funder to give that grant that kind of money, we have to begin with smaller pilot projects where we are looking back in time. So you're going to see that kind of thing. But yeah, it is very challenging. Vacant lots change over time, so that's one difficult thing to sort of adjust for. If a vacant lot is supposed to be vacant throughout the study period, and somebody does something with it or sells it off, and we have to be able to track these things, and so that's one issue. And second, we had a 38-month study period. Well, what happens after that? We would like to know longer term, do these types of interventions have a sustained effect and or a changing effect, and what is that? But it takes really strong, it's difficult to get these collaborations going, and this sort of acceptability. So our partners have to be willing to sort of hold off and hold back on a treatment at the control locations that we know is beneficial. And so there's that sort of ethical sort of question there as well that is sometimes difficult to overcome. I don't know if that answers your question.
I'm just really surprised they get that many different types of metrics to combine in studies.
Yeah.
Your presentation was spot on in so many ways, so thank you for that. I wonder if you've done any research that taps into communities' perception of control and agency, specifically territoriality, and kind of anecdotally, in a study on the greenways here in Pittsburgh, some of the most best maintained greenways actually have a sense of neighborhood control and ownership, even though there is no literal ownership of it. And that's partially due to knowledge and partially due to activity and the things that you described, whereas other places where there's ambiguity over who owns or who controls or whose territory it is, then that degree of engagement doesn't happen. And it would seem that if we can hit that sweet spot of helping people understand the territory, literally and figuratively, then both their perception of the value of green space plus their engagement with green space would be really powerful. I don't know how to measure that. I don't know how to, that's like anecdotes, that's what I observed, but I don't know how would you measure that?
Yeah. Right, let me think. Well, we're getting at that somewhat in our Flint, Youngstown, Camden study, where different groups use different methods. So in some cases, it's just someone comes in with a mower. But in other cases, we are having these facilitated sort of design build exercises where communities are putting some landscaping in or marking an entrance to a neighborhood and designing a logo that might go on a fence and perhaps along a sidewalk. And so landscape architects and designers are playing really important roles there in facilitating this identification with the place and helping sort of a space be a celebration of a community. And if we can do that on this is my epidemiologist hat, if we can do it on a large enough scale, I don't necessarily believe that we need to have 600 study sites to be able to know, with a capital K, the truth, right? But we can do more detailed observations, testing these sort of different design elements. And that has been and can be done. Yeah.
Hey there, thanks for your talk. I just moved here from Philadelphia 9 months ago, actually. And I lived on a block in South Philly that was a gentrifying neighborhood and had an empty lot on the end. And it's really affirming to hear you talk about the different perspectives on an empty lot and going about greening it. And you've helped me to build more empathy for the various perspectives that I disagreed with at that point. So thank you. So my first question is around, you talked a little bit about some of the women and minority-owned business initiatives that are happening. So what are some of the things that are like sticky for folks, especially in the gentrifying communities and the people of color and low-income folks, that have helped to turn around the mindset on the greening of properties and what's worked or not? And then a second question is like a little more random. I'm fascinated by the increase in car theft and the decrease in gun violence around the greened lots. And I'm wondering if it could just be like a completely separate effect where the guns that you said are being stored in cars, more cars are being stolen, and that's why gun violence is going down. So just wanted your thoughts on those two things.
Yeah. Oh, I wish I had my anthropologist buddy here, like right here. I think that he could answer both of your questions probably better than I could. So what helps that acceptability? I think more engagement and more ownership over the whole process is the answer. And it's really difficult and a difficult question, because in a way we're sort of, it's the city that is coming in that has historically done so much damage and perhaps even caused, all of this distrust, now saying, well, trust us, we're trying to do the right thing. That's really difficult. So I think putting those as much of that decision in and with communities and the resources and allowing them to decide how that is going to be spent is number one priority. And easier said than done. Your second question about, remind me. Oh yes, the car. Well, again, I feel that we need an ethnographer to just camp out, or I hate thinking about this, but like sticking a camera on it just to see what is going on here. Why are we seeing that? And honestly, I'm not sure. I'm a little bit baffled by that one as well. I don't know, other than that these spaces perhaps are attracting folks that are looking for, something that's nice.
Hi, thank you for your presentation. I think it's really interesting but important that these correlations are being made with health and violence, and especially in more resource depleted and troubled neighborhoods. My question is probably a rambling one about sustainability of these efforts and engagement, and you've since spoken to it a little bit in response to Christine earlier. It seems to me it's one thing to green a neighborhood, it's another thing to get people to embrace it, to use it. Obviously, I suppose the use or the population of it helps to sustain it. Richard spoke of biophilia and said, some folks still may not know the word. That, I imagine, innate love of nature is probably somewhat muted in people who have either not lived in the midst of green space very much of their lives, they've lived in concrete urban environments, or people who have witnessed trees and parks more as hiding places or opportunistic places to involve themselves in unhealthy activity. So I think that it may not be, that nature may not so readily cause someone from a poor urban area, neighborhood, to embrace, to hug a tree, let's say, right? I've, in my past, taken young people tough young guys from the inner city into the woods, and they're terrified, and they're not relaxed, they're much more tense. So obviously there's something more that has to happen too. That love affair has to somehow be stoked. So I'm asking about anything that you have experienced or thoughts you have, but particularly if you have some anecdotal ideas about inducing that love affair, or as I was first asking about how to engage folks in the spaces that that communities might be fortunate enough to create and establish.
Yes, I agree. I share that question. It's at the top of my mind, and the Forest Service, as well as putting in, institutional resources into answering that question. And I can just speak from my own experience. In Philadelphia, we have a nature prescriptions program at the Children's Hospital. Some pediatricians have begun to give prescriptions to their patients to spend more time outdoors. And we're not the first. There are other programs in the Bay Area and in Boston and Washington, D.C. And there's a lot of question, well, is it really that simple, right? That your doctor would just tell you to go outside and you would just do it. And we know in Philadelphia that it isn't that simple. That there is a lot, right, to change our behaviors and our way of life and the way we view the spaces around us, we need a little or a lot of hand-holding. And so this program run by the Schuylkill Center for Environmental Education, so they're managing this program. They have hired what we call nature navigators. They have 2 nature navigators. They have combined background in casework, so social work, as well as environmental education. And they are, in and from the communities, which these patients are coming from. And so they will follow up. So I think, we have a screening that indicates, nature deficit, extreme nature deficit, refer to the nature navigator. And then the navigator will follow up and work with the caregiver to try to adjust schedule and or involve and do a bit of hand-holding, right, to bringing an introduction to the love of nature. And there's so much, and even that is, as I just say it, is more easier said than done. Yes, and is it and can it be successful, and in which cases is a big question, and I think deserves a lot of resource and attention. Yes, I share this question and so many others too. Important one. Oh, okay.
But can we all thank Dr. Kondo again for that? And I wanted to thank you all for coming out here this evening. My name's Dr. Maria Wheeler-Dubas. If you've ever been to our biophilia meetups, I know I've seen a number of you there. Thank you for joining us for this event. It's a much larger scale, and I'm very much so looking forward to tomorrow, as well as I was very much so looking forward to this evening. A few quick thanks before we go too far. An event like this comes together through the work of a lot of people, both planning for today and tomorrow. And I just wanted to quickly thank our event sponsors, Evolve Environments and Architecture, Duquesne University, Jewish Healthcare Foundation, Greenhouse Renovation Services Incorporated, and Anonymous Family Foundation. Thank you all so much. We really appreciate the sponsorship. Thank all of you, our guests here. One of the things that really stuck out to me was a picture in this, in your presentation about children out in a vacant yard and their work out in the world. And one of the things that drew me to becoming a scientist when I was a kid was my sense of wonder for the natural world. And I was actually just speaking earlier about Rachel Carson's sense of wonder with someone earlier today. And especially if you're coming back to tomorrow's part 2 of the symposium, I would encourage you all just for a few minutes, either tonight or tomorrow morning, to just let your sense of wonder go. Stand outside under the stars tonight, or tomorrow walk outside and just appreciate the sunrise in a way that you haven't given yourself permission to in a long time. Just let that sense of wonder wash over you. It'll let that appreciation and love for nature just come flying back, and you'll be ready to go for tomorrow, the next day of the symposium. And I look forward to seeing a lot of you tomorrow as well. Did you want to?
I neglected to say the sponsors, and you got it.
Oh, great. Well, thank you all so much. We will still have some snacks and beverages outside. So please feel free to stick around. And if you had any questions you didn't get to ask Dr. Kondo, she'll be here as well. So thank you all. Hope to see you tomorrow.